I kind of wanted to shift gears because I think that the biggest part of the opioid problem we've had in America is the business model to treat pain has been wrong. Doctors, at least in my Kentucky district, have, for whatever reason, overprescribed opioids for the treatment of pain. And I think that we've come a long way in education, in educating our medical providers on the perils of opioids. But my question, Director Carroll, is as we move forward, we talk about the opioid issue. Again, I will say over and over, I think the number one thing that we can do is secure the border. But as we move forward, there are a lot of people in America that have legitimate pain. And there are people that deserve and have the right to treat their pain. One of the things that I've been doing a lot of research on is alternative forms of pain treatment. In Kentucky, before I came to Congress, I was Commissioner of Agriculture, and we became the first state to legalize industrial hemp. And the hemp industry in Kentucky and in many states now is really booming. It's an emerging industry. And one of the biggest products that's coming from industrial hemp is CBD oil, cannabidiol oil. Non-THC, so we're not talking about marijuana, we're talking about hemp. Non-THC CBD oil for treatment of minor pain, like inflammation and other forms of minor pain. This seems to be really making a difference. We also, in my research, my staff, we've listened to physical therapists, chiropractors, other forms of alternative forms of pain treatment. Director Carroll, what are your thoughts on how we move forward in trying to treat pain in America, other than the old business model that has failed so miserably in prescribing severe pain medication?
I apologize. One of the things that I think is important to do, and actually the Commission talked about this, was removing the pain questions when there are surveys from healthcare professionals. Working with HHS and working with members of Congress, one of the things that we have done is removed the pain questions from the reimbursement side. So effective October 1st, 2019, the questions on pain as they determine reimbursement rates will no longer be asked, so that people understand that sometimes if you have, I think we were talking earlier, one of the young men who lost his life was because of an appendix, is to be able to say to them, it's going to hurt. You just had surgery. And so by removing the pain survey, that's one of the things that I appreciate the committee and Chairman Cummings and I have talked about too, is making sure, is that we treat appropriate pain, but we also don't spend too much of an emphasis on it. In terms of the CBD, that's something, again, I think HHS is going to regulate to make sure that we understand the health impact of it. I don't know if Dr. Rattay feels differently, but right now I think we're on the cutting edge of research to show the
gentleman's time is